August is Spinal Muscular Atrophy Awareness Month. Here to tell us more about this disease, we have Dr. David Neil Tupin from UK Healthcare. Good morning. Thanks so much for taking time to talk with us.
Thank you for having me.
Yeah, I feel like this is one of those that maybe people might have heard of, not really sure of. What is spinal muscular atrophy, and when is it typically diagnosed?
So spinal muscular atrophy, or SMA, is a genetic disorder that affects typically infants. It is a disease of the nerve and the muscles, and unfortunately it causes progressive weakness over time. And so unfortunately, without treatments, most of these patients would pass away by the time they're 1 or maybe 2 years old. Affects probably about 4 to 5 patients in Kentucky per year, and about 2 or 3 patients in West Virginia. It is diagnosed typically by the newborn state screen. That's the heel stick that babies typically receive when they're born. The diagnosis comes back typically pretty fast, in a matter of days. Then patients are referred to someone like myself, where we do more testing and then start treatments as soon as possible.
Oh my goodness. Okay, so let's talk about some of the breakthroughs. How has recent updates in gene therapy changed the outlook for patients and their families?
Yeah, if it weren't for gene therapies and the breakthroughs in treatments, I probably wouldn't be sitting here talking to you today. Really amazing treatments have come out, and so gene therapy is one of them. Gene therapy is an IV one-time treatment that gives the babies back the pieces of DNA that they're missing, that allows their bodies to make the proteins, that keeps their nerves healthy, and keeps their muscles strong. And so babies' muscles are strong. They preserve that strength so that then they can go on to walk, to crawl, to meet the normal milestones that babies will experience. And the babies will, over time, eventually have normal strength, which is really remarkable.
Oh, and that is wonderful. Okay, so talk about what you all do. What sets UK Healthcare apart in treating spinal muscular atrophy?
Yeah, so we have an amazing team here at UK, both on the front end and on the back end. And so when patients are diagnosed, they'll meet with someone like myself, who will move quickly to get the diagnosis confirmed. And then we have a team of nurses, pharmacists, infusion team that will make sure that the baby is treated safely and quickly to preserve as much of that strength as possible. Then, after the baby is treated, we have a team that will continue to monitor the children in the months and years ahead to make sure that they continue to meet all those milestones and that families are supported. And that team, we call it our NEMO clinic. We have doctors, we have physical, occupational speech therapists, social workers, and others. It's a really great team.
Oh my goodness. So is there anything about this disease that you really wish parents and just people knew more about?
Yeah, so I hope that people can recognize the name of the disease, and that if they happen to have, someone in their family who is affected by it, or even if they come across someone online on Facebook who's affected by the disease, they encourage them to get treated quickly, because the earlier patients are treated, the better they do long term. And then also to recognize that there are some cases where the newborn screen can miss patients. And so if you or someone you know has a child who is not meeting milestones on time or losing strength, it could be something like SMA, something that could be treated.
Oh, that's great. Yeah, get everything checked out. So why is it so important to keep raising awareness about this disease?
Right, and so August, as you said, is SMA Awareness Month, which is great. I'm happy to be here and talk about this. But I think that there's also some lessons to be learned about SMA that will hopefully apply to other diseases over time. It was just until quite recently that SMA was an incurable, fatal disease for most people. And thanks to the perseverance of patients, families, scientists, the healthcare community, we now have these remarkable treatments. And I think that there are many other genetic conditions that affect children and adults that are unfortunately without treatments. And I think this is a lesson of hope and perseverance that hopefully others can see. And then we can keep this momentum moving forward in other diseases like SMA.
Yeah, it is very encouraging to hear you talk today and say that there is treatment and it works for these little ones. Dr. Tupin, thanks so much for sharing all this with us this morning.
Thank you for having me.
Yeah.